right, 6 minutes after 9 o'clock, we've got a Veterans News program ready for you. This is a full hour Veterans program, actually 54 minutes if you consider we're starting at 6 after. Dr. Jose Torres is in the studio to answer your questions, and so is Dr. Howard Eskildsen. The two doctors are here to talk to you about your health and about how the VA might be able to help you if you're a veteran, but a lot of us non-veterans also benefit from the information, of course. So good morning, Drs. Jose Torres and Howard Eskildsen. Good morning, gentlemen.
Good morning, Larry.
Good to see you both.
Good morning. Merry Christmas.
Merry Christmas to you, too. Thank you. How's everything going over at the VA?
Good.
I don't have a casualty list, so I apologize for that. We can take a moment and remember those who have lost their lives in their service. So and thank you for that, everybody. And so we'll do that real quickly, and then we will come back and I'll mention the sponsors. So before we get started, and just so you know that this is a call-in show, you're being invited to call in. If I can get my computer working here, 622-9622 is the number. Let's just take a moment just to remember those men and women who gave all, whether it's in the service or in as a first responder. We always have those folks on the list as well. We will take a break and remember them and be right back.
Amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found. Was blind, but now I see.
Real quickly, I wanted to make sure that I mentioned that the quarterly memorial ceremony is over at the Ocala Marion County Veterans Memorial Park 4 times a year. And the next one is coming up Saturday, January 6th. Believe it or not, January 6th is not too far away anymore. It'll be at 10 a.m. at the Veterans Memorial Park. If you don't know where that is, first of all, you're going to really appreciate the work that's been put into this memorial park. You can even remember a veteran of your own, or even honor a veteran who has not passed away. You can get a brick and have that person's name put on the brick and have it placed in the park. The park is at 2601 Southeast Fort King Street. The quarterly memorial ceremony is just a real touching way to remember those who have given their service to their country. They didn't all die in the line of fire, but many of them did live long and prosperous lives, and then ended up dying in their older ages. So it kind of runs the gamut of all those who have served us, who have passed on. Again, it's January 6th at 10 a.m. And this program, Veterans News, is brought to you each week by a couple of great sponsors. Bob Wine's Community Gardens and Nursery is one of them. Veterans News is brought to you by Bob Wines. They are located at 2610 Southeast 38th Street here in Ocala. When it comes to landscaping, Bob Wines has what you need, everything from small plants to large trees, mulch, fertilizer, and much more. And they even deliver, plant, and guarantee their trees. And from what I understand, they even have some live Christmas trees, although it's kind of close. Maybe you've already got yourself set up with that. Bob Wine's Community Gardens and Nursery have been blooming, keeping you blooming since 1952, and they do offer a discount, 10% discount to veterans. Hires Baxley also is one of the sponsors of Veterans News. We want to remember them, the great work they do for all of us here in our community. Hires Baxley has had generations of families honor them with their trust and confidence. They believe it's because for the last 128 years, their team of caring professionals has established a reputation of serving families with excellence and compassion. Hires Baxley partners with the Boy Scouts of America Troop 72 to properly dispose of decommissioned American flags. They also are a drop-off location for the program Cell Phones for Soldiers, helping to provide minutes that matter and helping heroes home. Hires Baxley is located at 910 East Silver Springs Boulevard in Ocala. You can go to their website, hires-baxley.com, or give them a call at 629-7171. And I think the last announcement I have is the Veterans Resource Center is always accepting non-perishable food, basic hygiene items that they will distribute to veterans in need, whether it's canned food, if it's boxed, like maybe crackers or something like that, something that won't go bad. They're also taking toothbrushes and toothpaste, shampoo and soap, razors, deodorant, toilet paper, laundry detergent. I think you get the idea. And you can drop it off at the Veterans Resource Center, which is right next door to the Veterans Memorial Park, as a matter of fact. You can also drop off at Hires Baxley Funeral Services at 910 East Silver Springs Boulevard. All right, once again, let me reintroduce our guests. Dr. Jose Torres and Dr. Howard Eskildsen are here to answer your questions. Thank you, gentlemen, for allowing me to do all that. Good morning again.
We have an interesting topic today. We're going to talk about orthopedic lesions, which we're going to address today the upper extremity that involves shoulder, elbow, and hand and wrist. So between Dr. Eskildsen and me, we can answer the most common questions related to injuries or issues related to those extremities.
Yeah. Is there anything like a warning sign that you want to tell us about? How do you know something is going to happen?
Yeah, that's what we are going to step by step describe each part of the body and then go over some of the most common
Okay, so when my left arm is asleep while I'm sleeping, that's normal? Is that tell me something?
It can be
you got a serious
several
look.
issues. Yeah.
Really? It could mean something, huh?
Could be circulation, can be a nerve issue,
Maybe I'm sleeping on it.
posture. Yeah.
Yeah, I've had episodes where I've woke up, my arm was asleep, so one time I actually tried to hold it straight up in the air just to kind of get a different feel.
Yeah.
And my hand ended up hitting me in the face because I was so asleep it wouldn't even. But in about 3 or 4 minutes, I woke up. A lot of that is just what we call impingement of the nerves that come down there. Because in the upper extremity, you've got, and upper extremity, I'm talking about the body, not northern Michigan, the Upers. But you've got some nerves that go down through there too. If you look at the shoulder, you think of the shoulder joint as, when I thought of shoulder, I thought, well, you got this bone, it goes into a socket and end of story.
Right.
Well, you've got a bone that goes into a little, very, very shallow dish. There's not much of a socket. And
that
what really
right?
controls what the shoulder does is all the muscles around it.
Oh, okay.
Those of you who have pectoralis muscles, that's one of the muscles that does it. I don't know I do because I can see my ribs between in the mirror when I'm supposed to see the muscles, but that's a personal problem. But they're the pectoralis muscles. There's some muscles around the shoulder blade that involved with that. And there's actually 3 bones that form the joint of the shoulder. And the collarbone, if you feel that out towards the shoulder, you'll feel it hit a bump, which is the tip of the shoulder blade, which goes on the back. So it forms kind of an A-frame. So you can actually move the shoulder up and down, but the
amazing,
collarbone and shoulder blade can do that. But the problem is you've got also blood vessels and nerves go down there. So you get the wrong position, you can compress those. And if you compress a nerve, it goes numb or gets weak. If you compress a blood vessel, it starts to hurt because it hurts when you don't get blood flow to different things.
So my reaction was I thought I was saying something silly that my arm falls asleep because I feel like it's happened all my life. So it's not just an older age thing. But you did have a serious look on your face when I said something about it. So it could be serious and it might be nothing. It could be either or, right?
It could be either or, like could be related to postural changes during the sleep. Those are the most benign signs of it. And then, like Dr. Eskildsen was saying, when you change your posture, then your arms start waking up again because the impingement, either by blood vessel wise or nerve, it's gone at that time, and then that's when the either circulation come back and the nerve impulses are returning to the arm. People with atherosclerosis, they can have occlusion of the artery that comes in that area called subclavian artery, and if you have stenosis or narrowing of the lumen of that artery, you can have changes in pressure and pulse in between right or left.
So what do you do if there is a problem? How do you correct that?
Depending of how bad is the occlusion, then vascular surgery is indicated.
Oh, okay. So
There's actually a thing called subclavian steel in the left arm, where the artery that takes off to go to the arm is such that it's the same artery that goes to supply the blood with brain. If there's been some narrowing in part of that artery, when you move your arm, it steals blood from the brain.
Oh, that's not
and
good.
some people actually have a dizziness, or what we call feeling like they're going to pass out and move their arm. That's very rare. I've been practicing for 40 years, and I've seen one case of that.
Wow, but it could happen.
Yeah, it could happen, but it's left arm specific as that anatomy.
Is that right?
Yeah. The funny thing when you're dealing with not nerves, but I mean with tingling and numbness, that can come in the upper extremity anywhere from the neck to what we call the thoracic outlet, which is from where the nerves leave the neck down to the shoulder, underneath the collarbone, down underneath the armpit, on down. That will give you the glove type of numbness. Wow. Sometimes you can get nerves that are compressed at the elbow or the wrist, and they'll give different distributions.
So you mentioned the left arm only. Is there a connection between that and the reason why they always say you have a pain in your left arm if you're having a heart attack? Is there a connection between the two?
That would be something different. It's partly because the vagus nerve, which is basically what gives a sensation to the innards. That's a technical medical term, innards. Okay, the viscera, the heart, the lungs, is a stupid nerve. If your nerves to your hands operated like the nerves to the heart, the lungs, and the gut, if somebody touched your little finger, you'd know somebody was touching you somewhere from the shoulder on down, but you wouldn't have a clue where. And so it's not unusual for the nerve, the pain from the heart or even the esophagus to cause the strange pressure. It can radiate down the left arm. Rarely it can go on the right arm. It can go to the back, the neck, the jaw, sometimes the stomach. So whenever something's looking really fishy and they're having strange symptoms, you always start thinking, is there a heart problem going on here?
Oh, really?
And it's more common in females that it can do that. But when you're looking at the situation, you're not really worried, is this male or female? It's just, is there something strange going on here that I need to be thinking about more than, it's just a minor pain, give them some aspirin and call me in the morning.
Gosh, wow. Yeah, I don't know how you do what you do. All right, we do have a phone call. If you put your headset on, you'll be able to hear the call. And everybody's invited to call. The show's an hour long today, so we have plenty of time for calls and answers. The number is 622-9622. The first caller has been waiting a while, so thank you for waiting, first of all, and good morning. You're on the air.
Yes, thank you. Good morning, everybody, and doctors. You see, we all know that diabetes causes foot numbness and pain. Could diabetes also cause numbness and pain in your arms and your hands and your shoulder?
You can get a general peripheral neuropathy with that, and it's more common in the lower extremities, but yes, it can go into the hands as well.
Okay, thank you.
You're welcome. Thank you for calling.
So when we talk about the upper extremities, and you mentioned the neck as well, huh? That's all part of it?
Yes.
See, the muscles that attach on there, the muscles form a lot of the stability of the joint because you don't have a nice deep socket for the bone to fit into. For the arm bone connected to the shoulder bone, well, it's not a very good connection. So you've got the muscles, and they attach to the to the pectorals, which are in the front, and then there's a trapezius back there too that attaches to the neck. And if you lift something heavy, it's not just the shoulder that's taking the brunt of that, but also the chest wall is the anchor for activities that involve the arm. So certain problems with the arm can cause some pain around the chest where the ribs attach to the breastbone, or can be related to neck pain. And if a person has a ruptured disc that puts pressure on a specific nerve, sometimes the rupture of the disc will refer to some pain right to the top of the shoulder blade in the middle, kind of, towards the midline, and in addition to other symptoms that go along to whatever nerve root is disrupted.
Wow.
So it can be really strange the way the presentations with this.
We're up against a break, so let's take that break real quickly. We'll be right back. If you want to call the doctors, you're welcome to call. The number is 622-9622. If you're a veteran and you've never heard of Veterans Helping Veterans, why don't you go and introduce yourself? You will find yourself among friends, and you'll be part of a growing community of veterans who are helping other veterans. And the website is mcveteranshelpingveterans.org. And their phone number over there is 433-2320. We'll be right back with Dr. Jose Torres and Dr. Howard Eskildsen in just a bit. This is The Source, WOCA Ocala.
The calendar's rolling, the clock's ticking on last-minute gift ideas. Time for you to give gifts that keep on growing from Bob Wine's Camellia Gardens. Bob still has florist quality foil-wrapped poinsettias at a super low last-minute price. They were $5.98, but this week you get 3 of these poinsettias for just $10. Bob has wonderful Christmas cactus, many different sizes starting as low as $3.99. And what a great gift. Listen to this. Bob Wine's famous camellias, 5-inch pots, were $14.99. Now last minute price to just $9.99. You can't go wrong with the Bob Wine's gift certificate. Plus you get up to $60 free when you buy them. Special last minute store hours this week. Daily till 5, Saturday till 3. Bob Wine's Camellia Gardens, Southeast 38th Street, your Christmas holiday place for 65 years.
This is Joe and Patsy Martone.
Wishing you a Merry Christmas
And a Happy New Year.
from
WOCA, The Source.
Hey guys, looking for something unique? Then try TripAdvisor's #1, the Gypsy Gold Farm Tour. What's so special? Your 2-hour tour begins with one of the most unique stories in the annals of equine history and continues with a walk to meet historical gypsy vanner horses and more. Photo opportunities and a gift shop await your holiday visit. Tours are every Wednesday, Friday, and Saturday from 10 a.m. until noon. Only $20 per person. Children 5 years old and under are free. Book now at gypsygold.com. Bicycles are great fun. You see nature up close. You get no impact exercise. The possibilities are endless. You can start your bicycling adventure at Brick City Bicycles. Young or old, experienced or a new rider, visit Brick City Bicycles at 217 Southeast 1st Avenue right here in Ocala. Brick City Bicycles has everything all under one roof. With holidays right around the corner, Santa wanted you to know now's the time to lay away that special gift. Stop by today. Brick City Bicycles. The folks at Honey Baked Ham remind us that now is the time to make your holiday entertaining plans. The holidays are coming up fast. Reserve your ham and turkey now. What about all the parties and gatherings? Honey Baked Ham is the answer there too. They cater breakfast, lunch, and dinner for intimate meetings or large parties. Again, reserve now. Honey Baked Ham is located on Southwest 27th Avenue behind Best Buy. Stop in or call 352-861-0011. Again, 861-0011. Honey Baked Ham, the world's best ham, turkey, roast beef, sides, desserts, and service.
All right, 24 minutes after 9 o'clock. We took our break late, so we'll have a very short segment right now, but we are still a whole hour long today, so Veterans News does continue up till 10 o'clock. You are welcome to call. The number is 622-9622. By the way, 71 degrees. Temperatures climbing to 79 today. You are in Florida for Christmas. Dr. Jose Torres and Dr. Howard Eskildsen, back to you.
Thank you, Larry. So we're going to discuss some of the common injuries related to the shoulder. Like we were talking before the break, that you asked if the neck is related to the shoulder, and I said, we mentioned yes, and it's because some of the injuries that can be reflected in the shoulder and we work up the whole area, like neck. We check for neck injuries, nerve compression on the neck that can be reflected and in the shoulder, and it's not the shoulder where the problem is.
Really? That's amazing. So and you have to figure out what's really the problem. If I tell you my neck hurts, it might not be my neck.
Yeah, and sometimes we can almost sound obnoxious because I've got some pain in my arm and it's numb in my hand. Well, I need to know exactly where, so I'll ask where. Well, I told you it's my arm and my hand. Well, is it the one side of the hand, the other side is up here? Because those details that we're digging for help localize where the problem
Really?
might be.
Wow.
We're not trying to be just nagging, we're just trying to get the details so we know what's happening with that.
And are the causes sometimes like a tumor growing or something? In other words, it's not always an accident. It could be something naturally occurring in our body. A tumor sounds serious.
Yeah, tumors are rare for that sort of thing.
Okay. But I mean, do things like arthritis, is it a growing condition?
Arthritis is one of the common causes of shoulder pain. Also, rotator cuff. A lot of people hear, I have a tear in my rotator cuff. So the shoulder itself has muscles, ligaments, and tendons in it. And depending on your physical movement, or you can traumatize the articulation if you lift heavy things for chronic or long time of periods. You can have tears. Or if you're doing sports, lifting weights, and you lift the wrong way, you can have a tear also in your tendon.
Is it actually torn? Is something actually ripped apart?
Yeah.
Wow. And so is it bleeding then if it's ripped apart?
Not in the tendon part, but it's very painful, and that need repair by orthopedic surgeon.
And that would happen because we're throwing baseballs too hard or something?
That can happen too.
Yeah. So it is from use.
Well, it depends on the age group too. In a younger age group, it usually is use or a traumatic type of thing. In older age group, I mean, not so old. I mean, people my age. Anyway, in our age group, you get just some general wear and tear and general atrophy, and that can lead to some tears as well. Because what happens is there's three main muscles that form the rotator cuff, and they call it a cuff because the tendons go out and they don't actually have individual tendons like a little string. They have a web of stuff, and they all kind of fuse together that go from the back of the upper shoulder over the top of the shoulder towards the front of the shoulder. And depending on which muscle where it attaches, it can move it different directions, including rotation. That's why we call this cuff of tendons the rotator cuff. But the problem is if the rotator cuff goes right underneath that knob on the end of the shoulder blade. So when you raise your arm up and above, the arm bone gets pushed against that and squashes the rotator cuff in there, so you can get a wear and tear from what we call impingement.
Really?
And so you want to have a little bit of physical activity and stuff to keep the muscles toned, because certain muscles pull the arm bone down so it doesn't squash that as much.
To keep it veteran specific, is there something that a veteran might have done while in service, maybe carrying a heavy piece of equipment or something that would cause a problem that doesn't even show up for 10, 20 years? Is that possible?
That can happen. That's considered military-related injuries, and those type of injuries are initially evaluated by the compensation and pension team, and then in primary care we just follow the lesion related, and the veteran can be service connected depending on the lesion.
What's more likely, that they'll notice something right away as opposed to it surfacing years later?
The shoulder type of thing, they would probably be aware that something happened, because
right away.
in that age group with what they're doing, there's likely that there might be an acute partial tear, or if they had a complete tear, that would limit their function to the point where they would have seen somebody for it. But partial tears are fairly common, and they can be painful off and on. And a person would know, I mean, a lot of people live with pain and just kind of put it in the back of their head. That's just what we do. But a lot of, if they'd had something from the service, they would probably know that there was something not quite right there, but says, well, I got work to do, I'll just work my way through it, I'll gut it out, I'm tough, or,
so many
I'm
more
not going to
questions.
complain.
I want to take a break and we'll be
Okay.
right back. I apologize, we took the last break
no
so
problem.
late. We've got a half hour left. If you'd like to call in, we would love to hear from you. The number is 622-9622. Dr. Jose Torres and Dr. Howard Eskildsen when we return.
Fox News Radio, I'm Chris Foster. Congress has until midnight tomorrow to pass funding to avoid a partial government shutdown.
Republican House member Mark Meadows.
I'm optimistic we can get there. We're not there yet.
Senate Minority Leader Chuck Schumer not sounding as confident.
It's their responsibility. They haven't shown us any plan for how they're going to get it done.
The House Rules Committee is meeting this morning to get to work on a solution.
Fox's Rachel Sutherland. 19 people are hurt in a car attack in Melbourne, Australia. Police say the driver's mentally ill with no known ties to terrorism.
Police are saying at this point in time this was a deliberate act. They have arrested the driver and a second man. Now, this incident happened in a busy pedestrian area. One child is said to have a serious head injury.
Fox's Kitty Logan. Police now say they don't think that second man arrested is connected to the attack. The driver's a 32-year-old Australian of Afghan descent. Fox News. We report, you decide.
When it comes to the holidays, the hustle and bustle doesn't stop. Well, unless your car breaks down. Whatever this season brings, it helps to have Hum by Verizon. Hum is the connected car system that assists and empowers drivers. Now you can check your car's health from your phone, get help if you're stuck on the side of the road, and if Hum detects a crash, it can automatically notify emergency services. It's a smart way to stay informed about your car and keep your family safer on the road. This holiday season, get Hum and get where you're going. Visit hum.com or your local Verizon store for special holiday savings.
I just saved hundreds of dollars by switching to Geico. I've never felt more alive.
Disclaimer. Geico cannot guarantee you will feel more alive. You either possess functioning respiratory and circulatory systems, or you do not, or you are a zombie. If you are indeed a brain-starved zombie and you would like to save money on car insurance, the Geico legal team applaud your excellent life choices, even in your shambling afterlife. But we strongly encourage you to visit geico.com or download the Geico app. Please stay a minimum of 500 feet away from our large and presumably delicious brains.
Geico. 15 minutes could save you 15% or more.
How about a really different last-minute Christmas gift? Give a tree from Bob Wine's Camellia Gardens in Ocala. Bob has a huge selection, more types of trees than you can imagine. Prices starting as low as $59 for some trees up to 7 feet tall. How about a citrus tree? Lemon and lime trees, regularly $29.99, just $19.99. Last-minute deals on poinsettias, too. Get 3 for just $10. Larger sizes available. It's Camellia time, and Bob has them, starting at only $9.99. Want to get up to $60 in gift certificates free? Then buy some gift certificates at Bob Wine's Camellia Gardens. Last minute longer hours this week, too. They're open daily till 5, Saturday till 3. Bob Wine's Camellia Gardens, away from the Christmas traffic, Southeast 38th Street, Ocala. Celebrating 65 years of Christmas giving.
Putting the local back into radio. 24 hours a day, 365 days a year. WOTA News now.
Here is your 30-second news brief. Ocala police say they believe last week's deadly shooting of a Vanguard High School student was justified. A 70-year-old woman died yesterday morning in a single-vehicle crash in the 4200 block of Northeast 7th Street. Country music singer Michael Ray Roach was arrested in Eustis after he rear-ended another vehicle at a McDonald's drive-thru. Disney World workers rejected a 50-cent raise in a new contract, and the Star Banner has published an interactive map of some of the more impressive residential Christmas displays in our area. And that is your news brief from The Source.
I want a private pilot's license for Christmas. Only a private pilot's license will do. Don't want anything else. No dinky tinker toy. I want a pilot's license to play with and enjoy. I want to learn to fly an airplane for Christmas. I don't think Santa Claus will mind me. Do you? He thinks it's a great idea. He won't have to use a dirty chimney flue.
Brad, how'd you get in here?
Oh, hey, Dan.
I'm just working on the new commercial. I just wanted to make sure that people knew that the best Christmas present was getting their pilot's license.
And not a hippopotamuses?
Well, I thought it was a good idea.
So you thought it was a good idea to butcher a Christmas classic?
Well, not exactly.
Yeah, let's just tell them to go to Ocala Aviation.
Because getting your pilot's license
is the best present ever! Christmas!
Ocala Business Leaders Incorporated is a group of independent local firms providing a wide range of quality goods and services. Each firm strives to maintain the highest level of professional integrity and 100% 100% customer satisfaction. When you're looking for goods and services, call a member of the Ocala Business Leaders, and we are confident you will be pleased with the results. If you are interested in becoming a member of the Ocala Business Leaders, join us at the Ocala Elks Lodge, 25th Avenue in Ocala, any Wednesday at 7 a.m. and enjoy a breakfast on us.
For more information, check OcalaBusinessLeaders.com.
The weather is brought to you by MyFWC.com. Safe boating is no accident. Maybe a shower around in the morning, but for the most part, it's just going to be warm with sun and clouds today. High of 78 to 83. Partly cloudy tonight, a low 53 to 63. Tomorrow and Saturday are going to be partly sunny and warm with highs of 76 to 81 tomorrow and highs of 81 to 84 Saturday. From the Florida Weather Center, I'm meteorologist Maggie Johnson.
All right, thank you, Maggie. Let's return to Veterans News again. Dr. Jose Torres and Dr. Howard Eskildsen are here, and Joe Martone is joining us. So good morning, all three gentlemen.
Gentlemen, did you hear that? Gentlemen.
Which two of us is he talking about?
Whoa, wait a minute. That's what I missed this morning when I got caught in traffic. I didn't get here in time. The holidays are upon us.
Mm-hmm.
And have you touched on the hours at the VA clinic is going to be? Are they just going to be closed for the Monday, and that's it? Or do you know?
The VA clinic is going to be closed by only Monday, yes.
They close on early Friday?
No, sir.
Okay, so.
We operate 7:30 to 4:30.
Okay. If I don't ask, I don't know. Yes, and our listeners don't know. But everybody says about the system. And the system works well. We're lucky to have the VA clinic in here. I was driving down the road and I got a phone call from some young lady. I don't know who she was, but from the VA clinic. The other one, I call it on 42, the Villages Clinic.
Okay.
On 42 there. I'm personally getting an ultrasound. So
be sure to wear your earplugs.
I don't mind that. I don't like the MRI. So the MRI, but the ultrasound is not too bad. So are you free? I'm driving. And I said, well, I'm driving, but I hopefully, and it was, now this just happened, and it was for January, first week or second week in January. They scheduled me for it.
Mm-hmm.
But it's a heads up. It's a call. It's like, don't forget you have it at, kind of thing. We're scheduling it. You have been scheduled for.
Mm-hmm.
So, and I said, well, can I call back? Because I'm driving. I can't get to my calendar. And she says, definitely. But, everything was clear, But it was like that little extra, that call, that if you go there when you're supposed to be there, you will get serviced, quote unquote.
That's correct.
Taken care of, I should say. Taken care of. I have never waited more than 15 minutes of my appointment, and most of the time it is right on time or a little early. Of all the times I went to all the clinics. So, you hear these horror stories. Oh, we went there. Were you on time? Or did you just walk in the door?
Mm-hmm.
So
we encourage our patients to arrive 30 to 15 minutes earlier, because you need to go through the process. First, you need to see if there's a line, and second, get in the front desk, register, and check in. And then the nurse need to see you, and the nurse is going over several questions. And then, by the time that the nurse finish, you're sitting. You're not even seated when you go and see your provider.
Yeah.
So you go inside on time and you leave on time your appointment.
And it says it. Well, they'll say black and white is usually in black and white right there, or they'll verbally say it to you. And if you go with the Sims, it's going to work. It's worked for me so far.
Yes, and also after each appointment with the primary care provider or clinician in the clinic, the patient needed checked out to get the next appointment.
Oh yeah.
Next visit.
Yes.
So you know when you're going to see your provider or clinician for the next visit. So.
And then you get a call.
That's
Still get a call to reminder like a day or two ahead of time.
Yes.
Not that I never needed it.
We have volunteers working in the clinic that they call the veterans the day before to remind the appointments.
Yeah, it's I've aces. Don't get a big head, but don't play the aces with me.
Mm-hmm. Appreciate that.
It's true. I don't. Well, what I do, I don't lie. I'm not smart enough to keep track of it. So I say it like it is. I don't sugarcoat. And if it was crappy. I would say it's crappy, but it's not. It's and they're pleasant. 99.9. We're all human, But I try to get everybody to smile just a little bit. Corny jokes and all. You know how that goes.
Yeah.
Hey, I got him.
It's always good also to know the things that we need to improve, to make the service better.
Yes. Yeah.
For the patients and the veterans and the family members that come with the patient.
Okay. I know I got you kind of off track of what you guys.
I would say one thing about the family members with the patient. A lot of times, 2 sets of ears is a lot better than one when it comes to remembering and understanding what's happening. Plus, also, it's worthwhile to get a second perspective on what the concerns are that need to be addressed. So I encourage family members to come along.
Are you example? A patient comes to you and says, "How you feeling?" The doctor says, "How you feeling?" "I'm feeling good." Blah blah blah. Then the elbow goes into work. Boom, boom. Aren't you going to tell them about your
exactly?
All right. Well, I haven't. So like you say, that little extra elbow grease there. Boom.
And sometimes it just makes it a little clearer. But once in a while, we've come across something. I'm really glad you brought that up because we discovered something we really should be dealing with.
I'm guessing that a lot of times that happens with the topic you had earlier with if somebody comes in and they're not complaining about their shoulder pain or something, maybe that's the thing that they kind of figure is not important. Don't worry about that, right? And then the wife tells you, no, he's got some shoulder pain, right?
Like it's been for this amount of time, or it's been ongoing, or like we mentioned earlier, well, he's been sleeping and his shoulder hurts and his arm has been falling asleep, and what is that? So all these questions start coming out, and that's when we start interacting between images and theories and possible causes of the
Joe mentioned ultrasound. Do you use ultrasound to diagnose the problem with orthopedic things?
We use mainly x-rays at the beginning to verify the articulation and bones first, and then we can move forward with an MRI, which is specific. If the patient has a pacemaker or metal in the body, then we need to do a CT scan with contrast. And depends of some kidney functions and labs, then the CT will be with or without contrast. Same with MRI.
So. Is that all? Is it farmed out, or do we have the facilities around here to do that?
We refer the patient mainly to our sister in Gainesville or the villages as the first choice. Then if the capacity or the center is over 30 days with appointment, then that service will refer the veteran to a local radiology center to have completed.
Provider would, yeah.
Yes.
Wow. Amazing. Sorry, I took you gentlemen off track, but it was in my head.
No,
it spills out of my brain.
No, I think that's good because it clarifies where the services are available. And we'd love to have as much service here as we possibly can, but we have to live with what exists.
Okay, here comes another one out of my head. Services which would exist. How is our $7 million facility coming? Or is it $6 million?
Well,
any word?
The plans are moving along. We had a meeting 2 weeks ago.
Yes.
And we had a little discussion about it. So the place, we don't know where it's going to be.
Okay.
So we are only in the blueprints to see what type of model and structure and offices.
Do they know if they're going to take it, like, or for example, a closed grocery store? Are they going to take one of those over, or are they going to go shovel-ready place and build from the ground up?
That will be decided by the Gainesville planification team where specifically it's going to be located.
Okay.
Yeah, but I would think a closed bowling alley would be a lot more fun than a closed grocery store.
We already did the bowling alley with the Vets Helping Vets.
Oh, that's right. I forgot about that.
But we have the blueprints for it.
But it's the planification team is going to start working on that, and there's several clinics also besides Ocala. So we are in line for the new clinic.
Oh, there's more clinics?
Yeah, Gainesville.
Oh, well, even out of Marion County.
Yes, out of Marion. But we are in the line to build, either build or remodel
There we go.
to establish a new facility.
Now, one last question. I'm not trying to put you on the hot seat, but I am.
No problem. No problem.
Any time frame when?
Time frame was not defined by them yet.
Oh,
We can definitely say it won't be in 2017.
Here we go again. 1,000 convenience out of work, and we got the doctor here. Yeah.
But the positive thing is, we had a good meeting with the planification team and leadership, and I mean,
all positive more than
everything
negative.
goes positive, yes. Everything goes positive.
That's what we like to hear. It's exciting. Not that where you are is old, but it's old.
It is.
And you need. It's time to grow. It's time to grow because the population is growing exponentially. I mean, it's just.
Yeah, it's really burgeoning.
Yeah. The last number I heard was 55,000 just in Marion County, and that has grown.
We've been almost too successful as a community.
Little break right now, and we'll be right back. This is the Source WOCA. If you'd like to call, you are invited to do that. The number is 622-WOCA, 622-9622, and we'll give you the number for the VA clinic on the other side of the break. We'll be right back.
The calendar's rolling, the clock's ticking on last-minute gift ideas. Time for you to give gifts that keep on growing from Bob Wine's Camellia Gardens. Bob still has florist quality foil-wrapped poinsettias at a super low last-minute price. They were $5.98, but this week you get 3 of these poinsettias for just $10. Bob has wonderful Christmas cactus, many different sizes starting as low as $3.99. And what a great gift. Listen to this. Bob Wine's famous camellias, 5-inch pots, were $14.99. Now last-minute price to just $9.99. You can't go wrong with the Bob Wine's gift certificate. Plus, you get up to $60 free when you buy them. Special last-minute store hours this week. Daily till 5, Saturday till 3. Bob Wine's Camellia Gardens, Southeast 38th Street, your Christmas holiday place for 65 years.
This is Joe and Patsy Martone.
Wishing you a Merry Christmas
and a Happy New Year.
From
WOCA, The Source.
Hey guys, looking for something unique? Then try TripAdvisor's #1, the Gypsy Gold Farm Tour. What's so special? Your 2-hour tour begins with one of the most unique stories in the annals of equine history and continues with a walk to meet historical gypsy vanner horses and more. Photo opportunities and a gift shop await your holiday visit. Tours are every Wednesday, Friday, and Saturday from 10 a.m. until noon. Only $20 per person. Children 5 years old and under are free. Book now at gypsygold.com. Bicycles are great fun. You see nature up close. You get no impact to exercise. The possibilities are endless. You could start your bicycling adventure at Brick City Bicycles. Young or old, experienced or a new rider, visit Brick City Bicycles at 217 Southeast 1st Avenue right here in Ocala. Brick City Bicycles has everything all under one roof. With holidays right around the corner, Santa wanted you to know now's the time to lay away that special gift. Stop by today. Brick City Bicycles. The folks at Honey Baked Ham remind us that now is the time to make your holiday entertaining plans. The holidays are coming up fast. Reserve your ham and turkey now. What about all the parties and gatherings? Honey Baked Ham is the answer there too. They cater breakfast, lunch, and dinner for intimate meetings or large parties. Again, reserve now. Honey Baked Ham is located on Southwest 27th Avenue behind Best Buy. Stop in or call 352-861-0011. Again, 861-0011. Honey Baked Ham, the world's best ham, turkey, roast beef, sides, desserts, and service.
All right, let's return now to Veterans News, and Joe Martone is here, along with Dr. Jose Torres and Dr. Howard Eskildsen. The phone number right now, if you'd like to call and speak to anybody here on the air, the number is 622-9622, and the number for Vets Helping Vets is 433-2320, and I'll let you guys tell the number to the VA clinic.
Go ahead, go for it.
352-369-3320.
Again. Always again. People are writing this, and you talk faster than they can write. So, please.
352-369-3320. 888-888-3320.
There you go. You and I, we do this, but they people, hopefully they know we throw a lot of numbers out on them during the segments, even the half hours and hour segments. So most of them have papers and pencils, and if they don't, they can always call here. We'll give them the numbers again. So I'm going to step back. I'm going to let you gentlemen continue what you're talking, and we thank you for what you're doing for all the veterans here and all the veterans out there. Once in a while, call them up and throw them a curveball and say thank you, and that's it, and then hang up. And they need it. No, don't throw them a curveball. Say hi, this is, and they answer the phone very, very politely, and then say we just called to thank you for your service, and hang up.
We've got a lot of very good people that come there and express their appreciation on a regular basis, and we do appreciate their appreciation. That sounds weird, didn't it? Sorry. Anyway, that's we do.
Hey, that's you. Hey!
Thank you. That's Howard is my first name, and of course it's been morphized into How Weird, and but I don't understand
Dr.
why.
E.
Dr. E. That's why I go by Dr. E.
I like that.
I did have one patient called me Dr. Estrogen because Eskildsen was too hard to pronounce, but I got back at her. I told her she was born 10 years too late to be a good hippie, and she was in the Army to boot.
To boot. Army to boot. I got that.
This is really bad.
That was a bad pun. Well, gentlemen, I'm going to leave you to your expertise here. I see you have more notes. We have less than 8 minutes to go. So again, thank you, gentlemen, for what you do, and have a good day.
Thank you.
Well, we could continue just a couple other little things with the shoulder. We talked about rotator cuff pain, and we talked about doing surgery, MRIs, that sort of thing. Whether or not surgery would be indicated would depend on whether it's something acute or chronic. And chronic means going on for 3 or 4 months. In other words, if you had a rotator cuff tear for 3, 4, 5 months, or most of us, it's been, when you get to my age, if there's a rotator cuff tear, it may have been there for a few years. Surgery is at the very bottom of the list for that. And specific exercises may help that considerably, which help with gentle range of the motion exercises that could be taught by a physical therapist. Sometimes injections can help. Once or twice would be okay. You probably wouldn't want to do more than twice into an area like that because of the side effects of the steroids. But that may help with that. And then just learning to use the muscle as it is, because there's other muscles that can help take over some of the function. If it's an acute thing, then the tear it may do well with surgery. The other thing is the surgery is a prolonged recovery period after rotator cuff surgery, and some people do very well, and some people have more trouble after the surgery than before if it's trying to repair one of the chronic sort of things. And you have to be very faithful to the exercises afterwards, because the surgery is one part, but the recovery is all based on complying with the therapy, which makes a big difference in the final outcome.
And is surgery a final resort? It sounds like therapy plays a big role with orthopedic issues.
Yes, and most of the tears are actually incomplete tears. I think I've gone through this once myself. I didn't have an MRI, but I was doing some push-ups, and my shoulder collapsed, and I couldn't do them anymore.
Oh, my gosh.
And we did some x-rays and stuff. I said, well, let's just do the exercises and stuff. And it took about 6-8 months, and back to where I can do normal function again, but I think there was a partial tear.
So if it can happen in your shoulder, it could happen in your knee?
Yeah.
And I know you're not talking about the lower extremities, but if it happens in your knee, wouldn't you just fall down? Like if you were doing push-ups and it
with push-ups, there's not that much stress on
what I'm saying, but if the same thing happened and you couldn't push up anymore, then if that same thing happened in your knee, would you just basically not be able to walk for a while?
Well, it would depend on the structures that were involved. In other words, there's ligaments that hold, they're called cruciates, that keep the knee from sliding back and forth. There's what they call the collateral ligaments, which are kind of like the hinge ligaments on the outside and inside of the knee. If one of those goes, when you raise your knee, it'll open up and turn to one side, and it could buckle. There's tears to cartilage, which can cause the knee to lock, but not necessarily give away. So there's many, many types of injuries that can happen to the knee that could affect it in different ways.
Well, when Joe was asking earlier if you farm it out, in his words, do the doctors at the VA clinic actually help with all the orthopedic procedures, or does it require a specialist?
No, we do the initial workup. We prepare the patient to see the specialist. So we start with x-rays, and then after the x-ray, we discuss if it's beneficial for the veteran to have physical therapy and see the progression and improvement. If the problem still and persists, then we can move along with an alternate plan with an injection and an MRI. And if the problem persists, we refer the veteran to orthopedic. But we need to do the whole workup before the surgeon see the patient.
Okay, so that way you have all. So in other words, you do things in order, I guess.
Yes.
Right? So that you don't do the easiest procedure first.
Yeah, the non-invasive part.
Can I ask you to interject a discussion about chiropractic procedures? Does that play a role in any of this?
Well, chiropractic mainly is for the spine. The chiropractors can help some, but basically when you go to the chiropractor, they concentrate more in spine issues and adjustment of the spine.
Okay. So that wouldn't have anything to do with your shoulders and...
They can help some, but it's not like a main or principal referral for the chiropractor.
Yeah, and basically surgery is like having a shotgun. You don't kill a mosquito with a shotgun. And if you've got the type of injury that can respond, and most of the injuries that we get will get better with time if we don't re-injure them, and oftentimes the best course is not doing some of the procedures that you're capable of doing. One time when I was in training, as my last year of medical school, I stayed with a doctor who was a rural doctor in Nebraska, and we were talking about something. He says, "Howard, this is one of those situations where when the doctor thinks he needs to jump in and do something, he needs a big butt and a big cigar, and he needs to sit on the one and light up the other." And there's a lot of times we can do things, but sometimes you're better off doing the simpler things like the exercises, the anti-inflammatories, because a lot of the pain will get better with time without having to cut somebody open. You only cut on somebody is if the trauma that you fix is worse than the trauma you create by cutting.
And do the supplements that you hear about on the late night infomercials, do they actually make a difference?
Well, there's several theories about chondroitin and glucosamine.
Yeah, that's the one. Yeah.
But when you have a lesion in your ligaments and your tendons, takes a long time to heal. So those supplements, they help, and but it takes, like I said, very long time to repair. It's like a combination of medications, which is the supplements plus non-steroidal anti-inflammatories and probably Tylenol or acetaminophen for pain management and physical therapy for range of motion.
Oh, really? So is this one of those things we've been hearing about lately where opioids are becoming too overused in our culture?
Yeah, opioids really are not indicated for chronic pain. In the past 2 years, the life expectancy in the U.S. has actually gone down, and the reason is drug overdose. And as physicians,
using it wrong. Okay.
And as physicians, we're partially responsible for this, for overprescribing. At one point, there was a big push, we'll get the pain scale, we got to get the pain scale down. Well, we'll give them narcotics. Whoops, we're causing more trouble than good with the narcotics. So it's really not indicated for the long term because of the dangers that are associated with it.
So I'm guessing that if somebody has upper orthopedic issues, that you're telling them not to go golfing and not to do heavy lifting or raising your hands above your head, that kind of thing?
Yes, sir.
Yeah, the ballistic motions, where there's rapid start and stop with a fair amount of force, that's something you have to be in good health before you'd want to be doing that. And you can always tell somebody, well, just don't swing as hard when you swing your golf club. Does that ever work?
Yeah, I know. How do you not swing hard?
I saw one comment about golf as a form of relaxation. Said the problem with golf is most of us play as if the free world state depended on our score.
Yeah, that's exactly right. Yeah, so it's kind of hard to kind of amend your behavior. We are up against the clock, so thank you both for coming in here. If I could ask you to once again just kind of repeat the phone number for the clinic.
Yes, the phone number for the Ocala Community-Based Outpatient Clinic is 352-369-3320. 352-369-3320.
Okay. Dr. Jose Torres, Dr. Howard Eskildsen, thank you for coming in and doing this every month. It's very informative. I'm sure we're piquing the attention of people who can relate to some of the conditions you're describing. Thank you for
Thank
coming.
you for the opportunity. Merry Christmas to our veterans and our community.
Thank you, sir. Merry Christmas to both of you.
Thanks.
We'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Fox News Radio. I'm Chris Foster. Members of Congress are trying to work out a spending plan to avoid